So hello, I'm Jane Lacson. I'm with the VA HTM program office. I work in the operations division.
Wait, how does this work? Oh, there you go. And I'm Nadia ElKaissi. I'm a biomedical engineer at the National Program Office as well. I work for the Cybersecurity division.
And welcome to the medical device interoperability, the importance of cybersecurity risk assessments.
Is it not working?
There it goes.
Oh, do I have to do it that way? Okay, sounds good. Cool.
So a brief overview of what we're going through. So first starting off with importance of cybersecurity in healthcare, then medical device interoperability, challenges in medical device interoperability, medical device cybersecurity risk assessments, and then we'll go through some case studies and then best practices. So first off, importance of cybersecurity in healthcare.
This is not working very well. So I had to like point to the laptop. How does this work? I'm cybersecurity and I can't figure this out. This is a problem. Maybe I should. Okay. Yeah.
Oh, you have to point it to the screen?
Should I point it to the screen? Is that how?
Yeah. I
Okay.
figured it'd be except for it's plugged in.
Okay, hold on. Let's test it out. No, maybe I'm just short. Am I short? Okay. Okay. No. Okay. Okay, I'll keep trying. I'm sorry, guys.
All right. Okay, well, good. All right. So medical device, by definition, is directly involved in patient care. And then medical device is the complexity, the number, and the diversity of the network connected devices. It exposes facilities to like a broader range of security and privacy risks than your typical network and endpoints. So if you think about it, about like every patient bed has about 10 to 15 devices connected per bed. And then through the entire US, about the number of beds, we have like over 913,000 beds. So that can give us anywhere from, at any point in time, we have like 9.1 million to 13.7 million devices in all the US hospitals.
Maybe you should do this. I'm sorry, I'm trying. Like, is it just like me? It probably is me. No. Sorry.
It's so weird. It's like chicken wants
All right.
No, that's forward, but how did you do
I
that?
think there's a delay on it.
Okay, I'm just gonna keep clicking. So, okay, keep going. Okay.
Okay. So first off, so risk posed by network connected medical devices, the increased bandwidth and competition to the network. Hospital data infrastructure needs to be adequate to support increasing bandwidth demands. Oh no, did it turn off? Did you?
This fine?
Yes. Yes, can you do it?
Just give me a little pause.
Just keep going. Do it to the end.
Oh
So
my
3 more
gosh.
points. We're
Oh,
good.
man. I'm so sorry. All right. So first off, the hospital data infrastructure needs to be adequate to support the increasing bandwidth demands on the network, with information needing to be readily accessible and reliable, with zero drops in downtime, especially when it comes to, you know, sending images or videos, or if a CT scanner has to send like thousands of images very quickly. And then, oh no,
Go back.
go back.
Alright.
And then increased risk for the medical device exposure for malware. Being on the network increases that risk to malware exposure when it comes to inadequate ports or protocol isolations or any physical attacks utilizing those unlocked hardware ports or having access to the internet. And then system integration challenges come from lack of standardization or needing to implement upgrades to a set of systems and making it work with existing legacy systems. These devices might need to talk to various EHR systems and have to utilize special device drivers or other middleware. And then increased data storage requirements and needing to adhere to hospital data retention policies. Some government agencies have a policy to, you know, keep data for over 70 years. So that upholding that data. So where it's all going will either need to be stored like on-prem or in the cloud. And then with those higher limits on the data retention policies, it can also increase, result in like an increased chance of that loss of data, whether or not if that patient data is stored on medical device or if the data is not like transferred directly for being backed up onto a server, or like it just continues to reside on the device itself. And then current cybersecurity threats, we got these 8 cybersecurity threats that are facing like healthcare organizations. For ransomware attacks, there are 2 threats such as like targeting attacks to the cloud backups, logs, archives, and or attacking like weak session connections that can stem from like weak authentication or bad identity management. Utilizing AI can also create automated programs that mimic human behavior and can be used in credential stuffing, data scraping, and DDoS attacks. So they target patient portals or they can steal sensitive data. Supply chain attacks and third-party vendors can bring a hospital system to a halt, especially if it like utilizes outside billing or other like IT provided that's not on site, like Change Healthcare could be a good example. And then there's also the phishing, like social engineering and insider threats that are always a concern that needs to be addressed and combated. In 2024 alone, I think phishing accounted for over 60% of healthcare breaches per Verizon's data breach report. And then the last one is like quantum computing. That's like going to bring in a whole new era of threats because as it exists now, it would blow through like all encryption protocols. Excellent. Next up, medical device interoperability. So there are 4 key principles that stand by when assessing new medical devices for interoperability into your system: the users, the reliability, the safety, and the integration. So being able to use the device reliably reduces any complications in training and like reduces like complications in handover. And then the device also has to be reliable to use because any like factors that aren't reliable need to be mitigated during those risk assessments. And then it has to be safe to use, whether or not that device has any like past or existing incidents that all needs to be factored in. And then obviously integration into the existing system. So ability to work with all the other devices. All right, and now challenges in medical device interoperability. So the challenges that are facing is like lack of standardization. So there is not a set standard of how to integrate like a device, or if you like buy like multiple pieces of equipment, or you can't like bulk buy like the same manufacturer model. So lack of standardization and how to like set that device up on your network. What ports and what protocols do you actually need? Where does it look to? And then usability and user interfaces. There's like the basics of the usability and user interfaces. You don't want like more is always you want more, but when it comes to using a medical device, you want it to be as simple as possible. With like a doctor needing to, or clinical staff needing to push like a button on an interface, you don't want the interface to be like too crowded, otherwise they get confused and like accidents happen. So and then challenges, cybersecurity threats. So like with the ever mounting like cybersecurity threats, like AI, malware, people coming into your hospital, physical attacks, on the network attacks, ports and protocols, like everything that just, it's a never ending onslaught of just cybersecurity. Plugging it into the hospital network, could be open to the internet, who knows. And then integration with EHR, whether or not you're doing like upgrading your EHR or changing over from an EHR that's like 40, 70 years old. That is always an issue because you have to make sure that the device will currently work with the existing EHR as well as sending information and then transforming that and make sure it works with like the new EHRs. Compatibility issues, we have your legacy systems and your old systems. So you can have like a single manufacturer model, but you have like Windows 7 working with like Windows 10 and Windows 11, and they all have, they're like all technically like running the same software, but because you're based on like different phases of like hardware upgrade, they always have to work with one another. And then cost and budget constraints. Maybe you might not be able to upgrade like your entire fleet of equipment. You can only upgrade like a small subset because that's all the money you have for that year. So you choose the oldest piece of equipment, but then you have to make sure that you're working within those realms of constraints. Right. And then challenges related to like network connected medical devices, the critical functions, for example, like these devices, the medical devices, like they sustain like life. So they're like clinical, like vital support, like life support. For example, like a defibrillator, you can't, put multi-factor authentication onto a defibrillator because that's just not possible. And then like the custom platforms as well, moving towards like commercial OS platforms like Windows, or sometimes the manufacturer will have like embedded systems. You don't know that, or if they're using like Linux systems, more and more manufacturers are doing like a black box, so you don't know what is actually going in there, and then you constantly ask, well, I need to know what's actually in your software, so if there's any issues or whatever, like we can address that. But because it's proprietary information or that, then they won't necessarily give it to you. Operational constraints, as you all know, like routine patching and applying those agent-based protections are really good for security, but you can't just have your medical device rebooting on you like in the middle of a case while it's on a patient, because that would be really bad. So having those operational constraints and like dealing with your other departments, making sure that you're scheduling the actual patching schedules, and like dealing with like the manufacturers, making sure you can actually patch it with this patch. Whenever we had like the print nightmare, WannaCry, all those, that was like a mad scramble to talk to all the manufacturers and make sure that we can put that patch onto the system as soon as possible without impacting any patient care. So, and then those operational constraints. So, and then we also have the technical limitations. So implementing those devices, they lack like standard security controls, like password logins, or like if you use like infusion pumps that are firmware based, you can't necessarily like change the inherent password or something. And then for EKG machines, interfaces are locked to like a certain medical diagnostic application. So like you could only use like Muse applications with like the GE or like things like that. Excellent. All right. So medical device cybersecurity risk assessments. So conducting risk assessments, NIST provided the framework on how to conduct those risk assessments. It's a suggestion on how to address like a risk assessment, and it breaks down into 4 components, where you identify the condition, utilize those results, achieve risk tolerances, and determine any additional controls. So, identifying the conditions where if the EPHI could be improperly utilized or disclosed without any proper authorization, utilizing those results to like make risk-based decisions and then implement those security measures, and then using those conditions as results to properly establish a risk tolerance range and ensuring there's a reasonable and appropriate level of security in place. And then finally determining if there are any additional controls needed to protect that EPHI. And then so the NIST framework brings into scope of what needs to be assessed and how. This goes further and identifies those 6 steps to the methodology for conducting those risk assessments. So you have your assets to be protected, identify the desired system functions, identify the threats, identify the vulnerabilities, analyze those risks, and then identify mitigation actions. First off, like assets to be protected. These are all different various like data points to be protected. So like, PHI, which includes like information about health stats, healthcare payments, or the healthcare system where it's linked to, personal identified information. So any information about that individual for the, birth date, social security number, patient identity, and any credentials that need to log in, such as username and passwords and tokens. Configuration data, so device settings that include network connectivity, and then clinical data, so any information that's collected or used in the monitoring or diagnostic of the treatment functions, and then logs that are generally aligned to the system itself, so like warning logs and the functioning logs. And then there's the device metadata, which also records like activity and interactions between the devices, and then any additional like alerts and warnings that the devices would throw.
What is the device metadata?
So just the device activity itself. So like what its like OS is, like any vulnerabilities, like just the MAC address, the IP address, like all that like underlying hardware data. And then next up, so identify the system functions. So the establishing like operating procedures and device management plans to set up and maintenance that device. So the device setup and configuration, Inventory tracking, so identifying the inventory of all the components of that particular system, wherever it's like the workstation, the server, a mid server, an integration server, the endpoint device, the application itself. And then what are those functions of the device? Does it like deliver medication? Does it treat? Does it diagnose? Or is it like a other healthcare device? The transmission of the data, so how does it transmit the data? Does it encrypt it at securely transmitted at rest or in motion? And then creating like a secure communication channel, so that's like maintenance coordination between vendors, so any like external connections and remote connections that need to go into that device. And then identify the threats. So we have all various pieces of malware that can include like virus, trojans, worms, rootkit spyware, network software agents, ransomware, and then the criminal groups that black hat hackers, hacktivists, terrorists, insiders, national governments, non-human events, defective equipment or hardware, and like non-adversarial threats. So that non-adversarial threats is like if damage is done like occurring through an inside employee, but it was unintentional and it was accidental. It was like an authorized user, but they didn't have any ill will towards the organization at all, and they accidentally like leaked some information. And then identifying the vulnerabilities. So audit and accountability issues is like the lack of security audits or assessments, vulnerability reporting and logging, wireless communication risks, which wireless communication so enables like medical devices to connect, but it can also pose a threat because if it's continuously enabled, it doesn't typically use like a closed network, or if it can use a closed network and like dedicated actual like wireless channels. And then you have like certain medical devices are designed using older technology, such as like older software versions or firmware. And additionally, these devices might not have been designed with security as like a key consideration if they were older. Then patch management issues. So the inability to update or install those security patches in certain medical devices could prevent like software defects from being addressed. And then authentication weaknesses. So lack of a robust authentication authorization procedures can also make medical devices vulnerable to unauthorized changes, as the authentication verifies the user identity. Many times you can like log into like a X-ray machine or like a portable if they're like all the users are sharing their passwords and information. It's like admin 123 or whatever. So that's a big risk. And then the use of removable media, that is if you don't have like your ports or your hardware ports locked down, and anyone that has like a USB device that comes in and plugs it in, or if like a vendor's bringing in like security patches or software, they can just plug it in, but they might be using a home USB or something happens, but with all the different ports that are available on medical devices now, that's something that needs to be looked at. And then inadequate encryption protocols. So the potential of like the lack of acceptable levels of encryption for data at rest and or in transmission. Clear text and unencrypted data storage or transmissions present those security vulnerabilities. Too many times you can look into like a database that a medical device is using and you could see like the patient information right there because they haven't like masked it. It's not encrypted. It's just a plain text database. And then many network connected devices also can operate in public. So that could also present those physical security risks. If someone like follows you into like a telecom closet, or if it's like a TV or workstation that's just out in like the public emergency department area, they can tamper with it. All right, and then analyzing those risks. So each threat and the vulnerability is analyzed against the effectiveness of any compensating control to determine the likelihood of that vulnerability that could be exploited, and then the potential impact if that vulnerability is exploited. So the impacts of a compromised device can be organized into two broad categories. You have your disruption of operations, which is the loss of availability, quality, and continuity of healthcare services, which is a primary concern with like, any physical sabotage, natural disasters, or any malware that affects the network. Additionally, you also have like those like DOS or DDoS or ransomware attacks that can be executed and like overwhelm a system resources and network connected devices impacting operations. And then, oh, one more, information loss. And then the information loss, so compromises of any medical device, particularly through like loss or theft, can lead to like significant breaches of sensitive data or cost to the organizations if they're losing a lot of data. Oh, okay. And then you have the mitigation actions. So implementing like strong access controls, using multi-factor authentication if it's available or if it's allowed, restricting access based on user roles and responsibilities, making sure you're regularly updating and patching those devices, ensuring that all the devices have the latest firmware and software updates, automate the patch management process whenever possible. Encrypted data, so employing end-to-end encryption for data in transit and at rest, using secure protocols like TLS or SSL, and then conducting continuous monitoring, implementing those real-time monitoring tools to detect suspicious activity, setting up any alerts and unauthorized access attempts. And then employee training and awareness, providing those regular cybersecurity trainings to all the healthcare staff, and conducting those simulations and drills to prepare for those potential incidents. And then developing those test incidents plans, creating those detailed incident response plans, having those tabletop exercises, making sure that they're realistic. Don't just like go and sit in a room and say, okay, well, what happens if malware affects our, like, and then you write down a couple of sentences. Actually, like walk through the steps, like take the incidents, tabletops, simulations, like seriously, and try and like mimic it as much as possible, because you're only as good as your training in like a real disaster response or like an incident response. And then segregating the network, making sure you employ like medical device isolation architecture. So isolating those devices from like the main hospital network, employing those ACLs, using firewalls, and the intrusion detection systems. And then conducting regular security audits. So performing those periodic security assessments and making sure that all the risk assessments and the controls and securities that you've put in place, you're analyzing that and making sure that your device is holding to that control. Don't say that, oh, well, this risk assessment said I'm going to turn off the service and I'm going to block this port, but then you go in and you check your workstation and like all the services are still open, your firewall is like wide open and everything. And then vendor risk management, so working closely with the vendor and making sure that those security measures are also like built into the device, including any cybersecurity requirements in your vendor agreements and your contracts. And then also implementing any physical security measures. So ensuring that your physical access to the medical device is also restricted, and like using locks and access badges and like PIN codes and keys.
Okay, so now, thanks, Jane. So now that you have your risk assessment framework, now you have to understand how you're going to apply this to the medical devices that you're procuring, right? So what we're going to be providing you with is a suggestion of how you can assess the risk of the medical equipment, what tools you can use. So a lot of times when you're assessing the medical equipment, you might have a cool new technology that you want to implement. So a couple of things that we usually ask the vendor is the start, because the vendor in the risk assessment, you need to understand how the medical equipment works, how it's integrating with the hospital. So we start with the ports and protocols, because you want to see and understand the networking behind it. If you're segregating your system, then you need to understand the ports and protocols, how it's communicating. Is it communicating to a cloud environment? Is it communicating to a server? You know, the MDNS inventory. So this is going to be understanding, is this going to be a segregated device? Is it an integrated system? How is it going to be implemented in your hospital? Because you also have to understand like the infrastructure, how you're going to integrate it. Do you have enough tools? Then you have your network topology diagram. That's going to kind of come hand in hand with the ports and protocols, because the network topology kind of understands how they're all talking together. So we usually ask that together because that kind of gives you a picture of the medical system. Then you have your MDNS squared. So that usually is where you're going to get your meat and potatoes, right? So that's where you're going to understand the logging, auditing, you know, antivirus, which is also going to be important when you're evaluating your system. And then the SBOM. So this is going to help you with your security of your software. So your software vulnerabilities, that's where you identify that, which will play into the risk assessment. So you kind of are a detective at this point. Okay, so we'll start with the asset identification. So usually, like I said, I'm not going to go over every single question, but you can have it here. But what I usually ask them is, okay, what is this device? What is this asset type? Is it a server? Is it a discrete device? Because that kind of will help me understand the operating system. Is this Windows embedded, so you can understand the risk of the system. Is it standalone? What is the manufacturer? Because that will help you with the recalls eventually if there's vulnerabilities, right? The primary user. So this is where you kind of understand how the users are going to use the equipment, what's actually necessary for the equipment to function. There's always a nice to have. The primary users probably want everything under the sun, right? But what you need to understand is what they're actually using it and how it can be secured in your hospital. And then you go into the list of systems and the device functionality. Okay, next slide. Okay, and then you go into the device software. So this is where you're going to understand like the software, and what you usually ask is this current software going to be unsupported eventually? Is there the most recent software version, and when is it expected to be released? This can also help you with the updates of your system, but also identify the risk. The software updates, is it manually, or do you do a manual intervention, or is it automatic? Usually when the vendors say that's automatic, then I start thinking, okay, is it a cloud? Like, how are you accessing our system? Which ties into your network topology, right? Because you're like, okay, how is this system going to be supported? The operating system. So you all know that we're all trying to minimize the unsupported operating systems that we're procuring in the healthcare environment. Now, a lot of medical systems, unfortunately, cannot move to like Windows 11, the latest and greatest operating system. That's going to be a problem. If they cannot, that shouldn't be a reason not to procure it, but that just identifies that you need to start tracking it and continuously monitoring the system more. The automatically patching. So patching is a big thing, obviously, for medical equipment. A lot of systems, the vendor cannot patch it either because it takes down the system and then that will affect the clinical workflow. So what we always try to ask is, can it be automatically patched, or do we have to plan a patching solution for the vendor? How is it going to be patched? Does the vendor have to go to a cloud or like some external connection to be able to patch the system or not? That's something because a lot of times vendors just want to patch from out externally, and that will be something that you have to identify in your network topology. Does a device support external connections? So we're going to start discussing a little bit about the external connections, and if you do, what you should be putting into place to allow for those external connections. And then do they allow for, or does the manufacturer address zero-day vulnerabilities? Because that's something important. Next slide. Okay, so MFA. I'm going to talk about a little bit of this. I'm going to go a little deeper into the subjects for MFA because this is a big topic moving forward. But so device access and authentication. Obviously, the ideal solution for any authentication is MFA, which is multi-factor authentication. However, how many of you have like bought medical pieces of equipment and the vendor says that the access is Biomed 123 or something like that? Most people, hopefully, yeah. I mean, normally medical systems, not all of them can have MFA, and that's something to keep in mind. But if it is, what you have to understand is that if you're watching and maintaining your passwords, you have to have a password policy. You need to make sure that they're being updated regularly. If they cannot, you need to work with the vendor to say, what's the process for us so that we can make sure it's at least updated annually or every 90 days or whatever. Do they have an interactive login, which is what I was asking. The vendor, what kind of access does the vendor support? And how often are they monitoring who has access from their side? So for example, if you have a big piece of equipment like Philips or imaging, obviously they're going to have service accounts, right? You need to make sure that they're managing their employees on their end because they are going to be passwords. They're not a multi-factor authentication with imaging pieces of equipment. And then the digital signature. So this is something that a lot of risk assessments don't ask. We do ask that in the VA, but basically we want to ensure that it's FIPS 186-5, which basically ensures that there's security controls in place when you're doing digital signature. So that's something you should ask the vendor ahead of time if you're noticing about this, because this will be important for you to understand the security controls. Next. Okay, so when I talk about MFA, this is going to be big because obviously the United States is increasing MFA requirements, right? Where there's an executive order that they're requiring all systems to be multi-factor authentication. We as healthcare individuals know that not every single medical device can have MFA or support MFA. So what I usually tell IT or whoever's enforcing this is think of it like your healthcare is like a kingdom, right? And all of us have little castles are for the medical equipment. You obviously want to protect the kingdom, But the castles, some of them are legacy or old, so those would be your legacy operating systems. Some of them cannot introduce, like for example, if the kingdom requires a moat, some of them won't be able to do that. But what they can do in place is add more security controls, add more guards, you know, they could add more archers and like, I don't know too much about castles. But anyways, you know, so basically that's what I try to explain. Even though we cannot implement MFA, there's always security controls in place we can do to compensate for that. The next. And obviously the limitations are like for the legacy systems, the device will not be able to do MFA. There may be hardware constraints, ease of access, and interoperability issues. Next slide. Okay, so what do we do? I guess I already talked about these issues. Okay, next slide. Okay, so what do we do? You always try to propose solutions. If you don't have MFA, should we isolate or segment our medical devices? Can we implement an indirect MFA with some scanning or barcodes? Do we have an external firewall monitoring tool? Start thinking about those things to compensate. That way you can help everybody else understand that it's not like you're just not implementing MFA, but there's a reason why, and here's what we're doing to fix this. Next slide. Okay, so now we're gonna do data storage and transfer. So data is important, obviously, for protecting the patient information. So usually what I start asking when I evaluate the medical equipment is, does it have a database? Does it support data, or does the database support patching? What I've started to notice with a lot of ultrasounds is that they're having databases. So those are the things you need to start digging into. Where is the data being stored? If it's data on rest, or data in transit, or data in rest, how are you doing this? Is it SSL connection? Are you encrypting the data if it's data in transit? Where is there encrypting on the operating system drives? Is the sensitive data, is there purging process in place? How are we purging the system? Because a lot of systems, you'll see the medical device, the data will be stored on the medical device for forever, you know? So that's something you have to think about. And do you have backup solutions? Are there recoveries in place? Like if the operating system drive gets corrupt, and where is the sensitive data being stored if it's stored outside on the cloud base? Because then you have to ensure the protecting of the data, with the authentication of the cloud-based solution, all that fun stuff. Okay, next. And then it goes into the network topology. So you start looking into the network connections of the device itself. A lot of times when they say wireless, you say that's great. Is it FIPS 140-2 or -3? A lot of medical systems, we are trying to move to -3, but they are still -2. You do want to make sure that you have something in place though when they are wireless. And then the communication. I always ask what's necessary. I had one vendor ask me, I need to open 30,000 ports out to the cloud. And I was like, okay, why? And they said for patching. And I said, okay, that doesn't make any sense. Okay, so some things you need to probe them on is what's the communication, what's necessary for function, not nice to have, what's necessary for it to be in there. That will improve the risk of your system itself. Like I said, I always ask for a topology diagram because that can kind of give you an idea about how it's communicating and what actually needs to communicate and be opened up to your firewall or access control list. How many IPs are doing that? Because then once you're segregating your VLAN, that's when you start identifying like how many devices do you actually need in your VLAN for it to be functional. Bluetooth is coming up a lot more. What I'm starting to notice, and what people need to understand is that there are some security risks with Bluetooth. You start noticing, one time I saw a medical device that's like, yeah, I can connect to any phone. And I was like, is there an authentication before someone's able to access the information of the medical system? And they said, no, that's the whole point of the ease of use. Well, there's a security risk, right? So that's when I started saying, okay, well, we need something to verify, you know, that we have permission to access before you implement Bluetooth. So I always recommend like the latest version, but obviously like some of them aren't, but that's something you need to start asking, because like I said, a lot of times they just say it's Bluetooth compatible and you're like, okay, what does that mean? How are we using this? How are we going to use this in a hospital environment? And then the vulnerability scanning. So this is also going to be a huge one, and we're going to talk a little bit more about it a little bit in a couple of slides. But you start asking them, okay, so for vulnerability scanning, can it do active? Can it do passive scanning? Can it do both? Is it credential scanning allowed? A lot of medical systems cannot do credential scanning, so that's something you need to verify, as well as now the external connectivity. So how is vendor going to access the medical equipment in your healthcare environment? You need to verify, is it cloud-based solution? Are they accessing through a firewall? So those are the things, and we'll talk about a little bit more later. Okay, next slide. Okay, so this is talking about like the vendor access. So we talked about the MOU ISA. It's really important, since your data is going to be accessed from a vendor or external connection, to identify the memorandum of understanding or develop some type of policy of how they're going to have access to it, what they have access to it, the credentials, knowing their backup. If data is being stored, I one time saw a vendor that was storing the data in a database, and I asked them how long have they been purging the data, like once they like access it in their data, I don't know, some place that they have all the data, and they said it's been there for forever. And so that's an issue, because all your data is being stored externally, right? So you need to understand how they're securing your data transmission, defining the roles and responsibilities, understanding the compliance, and then their incident response if there's an issue or breach. And then their performance and reliability. So what's their performance, what they're needing to use the system for. Next slide. Okay, and then we start going over the ports and protocols. So I talked a little bit about the network topology and what's necessary. There's always high-risk pieces of equipment. So these I call the high-risk pieces of equipment because this is where the cybersecurity attacks come in, right? So this is where, and they're constantly changing. So this is gonna be changing in the next like day or so, you know? But some of the more prominent ones are like FTP. So that's your file transfer protocol, right? So that's how vendors are accessing your files. That is very vulnerable, along with 445, which is shared drive access. 3389 is RDP. So that's how remote access, and we've seen a lot of already cybersecurity attacks with that, right? So when you start noticing that, and even like I said, with the external connection, if the vendors are accessing that, you're like, okay, well, you have access to that. How big, wide range are you going to be remoting into? What systems are you remoting into your hospital? Port 80 and 443 is your web server access. Obviously, HTTPS is more secure than HTTP, but now we're trying to move into 8080, you know? And so asking them, can they move into 8080? Do they need 443? What do they need it for? And how do we limit it to what needs access to that through those ports? Next slide. And then I added a couple more: SMTP, SQL. So when I talked about the databases, you know, these are the ports for the SQL. So that's when you start going through there, and TFTP. So like I said, these are just a couple ports that I'm just mentioning. You have to keep those in mind. You have to understand the high risk ports and what's necessary when you're doing risk assessment. Next slide. Okay, so now we're going to talk about active credentialing. And as MFA is being pushed, so is active credential scanning, right? So active credential scanning is basically like, it's not going to be listening in, it's just going to be probing the system, right? For credential scanning to evaluate the vulnerabilities. It's ideal solution. It is the ideal solution. However, a lot of medical systems cannot work or support active credential scanning. It's being pushed, but the thing is, what we have to understand is how can we, if we have to do passive scanning, how do we implement a better security on that? Because the problem is with, we'll go through it a little bit, next one. Yeah, it is. The problem is, like, if you can't have and you have passive, it will increase the risk score of your risk assessment, because you're relying more on the vendor and you're not getting all the solution or all the information in immediately. So a lot of times you're going to miss vulnerabilities, maybe, you know. But the problem is you also have to explain to IT or whoever you're working with when you're evaluating the risk of the assessment and bringing it into your hospital. Okay, well, the reason why we can't do active scanning is because it's going to take down our system, or it's not compliant with the medical system, or it's going to affect the compatibility of the system itself. You know, the vendors will provide you that information, but then that's when you have to understand, okay, how are we going to do this? How often are we passive scanning, if that's the case, just to make sure you're more secure? Okay, next slide. Okay, so physical access. I know Jane talked about that a little bit. You have to also understand about the physical access of the equipment itself. A lot of times, and I didn't put this on this slide, but when you think about it, you have to think about what the system is, like if it's mobile, so like an ultrasound, the USBs. Something that we never ask, and something I always ask when we're evaluating the medical devices is, does it have USBs, and can we turn off the USB? What's the purpose of it? Because the problem is that if it's mobile and moving around, a lot of people then are able to just plug in a USB that could corrupt the system or hack the system, right? So trying to understand those security measures, where is it in place? How protected is it? If someone gets access to it or steals it, Are they able to access all the database, or how are they authenticating it with a biometric or a PIN number? So those are some of the questions that you need to ask. Like if it's a laptop, how are they logging into it? A lot of systems that have mobile pieces of equipment, you'll notice it's for ease of access, which is great. But then maybe there's just like a 1, 2, 3, 4 password, or it's just completely open, just to allow the clinicians the ease of use. That's something that you kind of still have to push the clinicians on to say, okay, well, I understand it's ease of use, but if this laptop goes away, all the data goes with it, so kind of moving towards that. Next slide. And then the incident response. So that's kind of like where I went through with the vendor as well, is how is it if there is a device and you get a corrupt file or there's a data breach, how quickly are you able to get this database back up? Is there a database backup? Is it in the procurement? So this is something you have to also understand, is that a lot of times the backup solutions aren't part of the procurement. So how are you going to protect the data? Do you have to procure another solution? How quickly, how quickly can you recover from your attack? A lot of times we have comm vaults, for server access. Those are things that you have to think about, because like I said, a lot of times it's not thought about during the procurement process. And the redundancy, if it is a server management system, does it have a backup? Do we have something in place? Can we do that? That's when you start asking the vendor these questions. They're like, okay, I understand we just have a production, but can we? Okay, sorry, no, next one, sorry, you're fine. Okay, so now we did that. Now we're gonna talk about some case studies, real life case studies of this stuff. Okay, move on to the next slide. Okay, so we're going to go through a couple of scenarios and kind of discuss some of the issues and things that maybe we could do to fix this in the future. So a doctor recently procured an exciting new piece of equipment, a portable ultrasound device that can connect to a personal smartphone and store the imaging in the cloud. This cutting edge technology offered enhanced mobility, allowed doctors to perform ultrasounds at the bedside, at the remote location, was instant, and then was able to review the results instantly from the phone, and then the data stored in the cloud, making it easy access to anybody and all colleagues across multiple hospitals. Okay, so next slide. So a couple of issues with that is, yeah, that's great. The ultrasound can be accessed through your phone, but what they were telling us originally for this was that it's any phone. So there's no security, no isolated network, there's no limit to how they have access, and there's no authentication method. So there's a lot of data concerns, and although it's easy for the clinicians, it is a problem for anybody that's in charge of the network, because you're worried about the data security. Who has access to that data? It's being stored in a cloud environment. Okay, so that's going to be another issue, because who has authentication to the cloud environment? Is there a backup solution? Is it managed, or can we move that database on-prem so that we have control of the database versus a vendor or a cloud? The network vulnerabilities, if it's from a phone, if it's from any phone, then obviously you can't isolate it because it's not in your healthcare environment, right? So although it's nice for some other hospitals to be able to access that data, you can't control who has access at what time. So that's something you need to do, like I said, and I talked about authentication risk as well as physical security risk, because if it's just random phones, if they got lost, someone might have access to that data itself. So like I said, some of the questions that we did deny this piece of equipment, but it's just because we needed more information. We needed a better solution that we could control. Like for the phones, it'd be nice to have a personal phone. Let's recommend having like a hospital or something that we could procure and control the IP base of the system. Make sure that it's identified in the access control list of the system itself in the ultrasound. So yeah, that's scenario 1. Scenario 2.
And then scenario 2, so a clinic adopted a new telemedicine platform to expand their remote consultation services amid increasing patient demand. The platform was integrated quickly, bypassing the standard risk assessment and cybersecurity review process. At the final stages, the system couldn't communicate with many of the systems in the hospital. The vendor asked to remove all access controls and firewalls to allow for connectivity. So this telemedicine platform did have a lot of pieces of equipment to it. They had like the virtual telecomputer, the computer itself to be able to dial out, a button to call the remote telemedicine person.
Move this to the next slide.
And then next, what?
Well, no, I'm gonna move it to
No,
this is inaccurate. So we're going to just so that no one's reading this one. Yeah, just worry. But she can keep talking. Yeah.
And then they also had access to be able to review the the ICU vitals. So they actually had to get access into the patient monitoring as well, into that server. So because we didn't do like the cybersecurity risk assessment wasn't done, they effectively didn't have any access control lists whatsoever or firewalls. So because it was implemented very quick, they wanted to get it working, and then it was blown wide open. Then when we actually started talking to the vendor, and I was like, what ports are you actually needing? Because you don't need all 30,000 ports, because that introduces a huge risk into being able to like use whatever ports you want to inject information or malware. It's like too many avenues to hinder the system. So then that also provided like configuration challenges, because now that the system was already implemented, we had to go back and reconfigure everyone's system, retest it, redo their reports. So it was like double work on top of it. So implementing fast is never the answer. Always do your risk assessments properly, because within that time period that those ports were wide open, we don't know, like we couldn't diagnose a problem if they didn't have any access. It's like they still couldn't get access. I was like, well, you're wide open. So at this point, I don't know what's blocking your communication.
Right.
So.
Okay, go to scenario 3. Next one. Okay. So this one involved malware infected an IT-enabled network device, medical device throughout connected oh wait, this sounds weird. Okay, anyways, basically the gist of this one was that a medical device was infected by a removable media device like a USB. And then because the vendor said that they needed access to do maintenance. And like I said, so this is something that you always have to probe, especially with a vendor. If you do need a USB to be able to do any patching or something, you always should have and implement a scanning solution for the USB. So it never should touch any medical device before someone from healthcare or IT evaluates the USB to make sure that there's no viruses, right? A lot of times USBs are the easiest way, that's great. However, like I said, the USB is probably the easiest way for a medical device to be hacked. So with this, in this scenario, you can move on to the next slide. A lot of the issues is that, it may operation disrupt. So there might be malware that affects the system. There's network vulnerabilities or loss of information. There's a lot of issues that could happen just because you didn't scan that USB for any malware. So a lot of hospitals, it's hard to implement that because you can't control what the vendor is. So you also want to make sure that you have vendor check-ins in place, making sure that anybody who has access to it, also who's accessing all the medical equipment in your healthcare environment.
And then also implementing those like media scanning stations.
Yep.
So having those stations like available in like Biomed or in the records department, having that access that has like, the antivirus scanning software that you can unplug from the network and it's still able to be used, and then scanning those devices, and then those are safe to be plugged into the device.
Yep, next slide.
Oh, okay, so one of the slides was hidden, but it's okay. This scenario 4 was an internet search of default passwords was being used for medical devices, resulted in a site that showed full procedures on how to remote into the device and the server residing on the healthcare system network. And this actually happened. But this was a classic example. I thought, like, going back, it was like a non-adversarial threat. These, the people, like the contractors, there wasn't like an MOU or ISA in place. They didn't know, like, they were doing good by writing out the procedures on how to remote into the device so that they can like review the cases and diagnose the cases. But when they actually put it on their site, it was not behind any like login page. It was just open to the public internet. You could just search it. And then it was also the default like admin password to access the server as well. So that goes to another point. It's like making sure you actually change the default admin passwords. You might get pushback from the OEM or vendor, but at that point, it's like, well, we already implemented this device like throughout the nation, and this password needs to be changed. There was pushback saying that they couldn't change it because it would mess up any server systems or services itself on the computer, but it didn't. So the passwords were changed from the default passwords. The actual people that uploaded the document procedures, they put it behind the password into like an encrypted folder share structure. So it was just like a little thing that like slipped through the cracks, but it also affected a lot of systems on the network. Whether or not they got hacked in or not, it doesn't matter. Like that default admin password is out there.
Right. So having a password management policy in place, and verifying authentication is going to be important. Next slide.
And then last up,
Best
best practices.
practices.
So
Excellent.
safety, the risk assessment process upholds like the 3 key principles. So safety, preventing that unacceptable risk, personal injury or harm to the healthcare patient and personnel. The effectiveness, so producing the intended healthcare result for the patient and healthcare system. And then the data and system security, ensuring that information and assets are reasonably protected from the loss of confidentiality, integrity, and availability. So that risk management framework, creating that risk management framework, utilizing the NIST cybersecurity framework, and maintaining that inventory of connected medical devices, whether or not you use like an IOMT or other like inventory storage system, having that available. Performing those vulnerability assessments, so conducting those regular scans, whether that be active or passive, for malware threats and unauthorized access, and evaluating the impact of the breaches on patient safety and data integrity. And then those security controls and training, implementing measures like those encryption and access controls, keeping your devices updated, train staff on cybersecurity practices and incident responses, and then monitoring and maintaining the vendor management. So monitor those devices for any suspicious activities, have a response plan, work with the manufacturers to make sure you have your external connections and remote accesses really dialed down and secure.
Excellent.
And then, so last up, so the conclusion, so cybersecurity risk assessments, they're essential for safeguarding your organization assets by ensuring the safety, effectiveness, and data security. And then by identifying all those and addressing the vulnerabilities, these assessments can protect sensitive information and ensure like smooth system operation. So as those cyber threats evolve, the robust risk assessments remain crucial for those organizations' resilience and security in the digital world. But the last point right there is like making sure that no matter how many security accesses and controls are being pushed, none of those security initiatives that will improve data system and security, but like it will not compromise the safety and effectiveness of the device. So the patient always comes first. And if you have a security or a protocol that's being pushed, like Nadia says, protect your kingdom, because there are other mitigating factors that you can use to make sure that device is safe for the patient.
Yep. And I think that's it. Yeah, thank you.